All right, so let's talk about Haemophilus influenzae. So Haemophilus influenzae is a gram-negative coccobacillus pathogenic bacterium. So coccobacillus meaning that it is variable in shape. And then on agar plates, the morphology consists of tiny translucent gray and convex colonies. So that's something distinct you can see when growing them on a growth medium. The next thing that I want to talk about are the biological properties. So Haemophilus influenzae is a facultative anaerobe, so it'll grow best in the presence of oxygen. But if oxygen is not present, it can resort to fermentation methods or anaerobic methods as well. It's also non-motile or non-modal, meaning that it lacks flagella and other motile elements or structures that other bacteria may benefit from. But that does not mean that it is not transmittable or it is not highly contagious. Haemophilus influenzae is primarily transmitted through respiratory droplets, so anything like causing coughing, sneezing, stuff like that. So it is motile in its own ways, I suppose, but it just lacks those actual structures. It's non-spore forming, meaning it does not produce endospores, and then it is also encapsulated. This is something that I want to highlight because this obviously makes it very pathogenic and very virulent. Just in for the simple fact that phagocytes will have a hard time ingesting this capsulated bacteria. The distinct characteristics that I want to talk about, something that I found pretty distinct, was the fact that this causes meningitis. So meningitis is a disease that causes inflammation in the membranes around your spine, spinal cord, and your brain. And this is distinct because this is the key factor causing meningitis. Next up is the fact that it grows on chocolate agar. So chocolate agar is lysed blood. So this is kind of pays tribute to its name, hemio meaning blood, philus meaning loving or affinity for. So this has a loving or affinity for blood, so it grows best on blood mediums or agars. A next distinct characteristic is the fact that it produces IgA protease. So IgA protease is an enzyme that breaks down IgA antibodies, specifically secretory IgA antibodies. So this obviously makes it very pathogenic and virulent. That's why I like to highlight this. But it'll break down any of those antibodies secreted from your tears, your mucous membranes, or your saliva. All right. So, what are some health concerns of Haemophilus influenzae? I had previously mentioned meningitis. That's probably the most popular one. Next up is epiglottitis. So, epiglottitis is the inflammation of the epiglottis. That's that little cartilage flap that sits behind your tongue. This is definitely considered a medical emergency just due to the fact that this will block off your airways, block off your trachea. Next up is pneumonia. So Haemophilus influenzae thrives or likes to live in your nasopharynx, so that's part of your respiratory tract. And if aspirated, this will travel down to your lungs, causing pneumonia. It also causes sinusitis, so this is the inflammation of your sinuses. And then it is also a key cause of septicemia, so sepsis, blood poisoning. This is when bacteria has entered into your blood. So these are all health concerns we need to consider when we are dealing with Haemophilus influenzae. All right, now for my first data trend, this is very broad and I did this on purpose, but this is the overall case rates of Haemophilus influenzae from 1997 to 2023, and this is per 100,000 cases. Now, I chose this one as my first slide because I wanted to highlight or kind of discuss the popularity or prevalence of Haemophilus influenzae. I wanted to see really how prevalent this is in our society. As we can see, it's been pretty consistent throughout the years, and I will touch on that in other slides and why that might be. But we can see that in 2020, we have a bit of a dip. And I like to talk about this just because this is not a biological matter. In 2020, obviously, we were facing a pandemic. Due to that, everybody was masking, distancing, practicing good hygiene. That everybody was more educated and aware of disease transmission. And so, due to that reason, Haemophilus influenzae obviously suffered a big decrease in transmission or cases. And like I previously mentioned, this is due to the fact that it's primarily transmitted through respiratory droplets. So if everybody's masking up, obviously the cases are going to decrease. This isn't because Haemophilus influenzae got eradicated. There's a new vaccine that came out. And then surely the rebound that happened in 2022 wasn't because Haemophilus influenzae evolved or adapted in some sort of way or that we made a new vaccine. This was just due to the fact that these mandates and that these laws all got lifted. Therefore, Haemophilus influenzae was then, being transmitted through, respiratory droplets, coughing, sneezing, stuff like that. So that is something that I want to point out, that Haemophilus influenzae has not evolved. It has not adapted in any sort of way. That rebound is purely due to behavior of society. All right, next up is select syndromes. So this is more so the disease that it may cause, or the symptoms that it may cause. And something that I definitely want to highlight is the fact that meningitis has sat well below 10%. This is due to the fact that meningitis, so Haemophilus influenzae type B, HIB, has a vaccine. It's a conjugate vaccine, and it's the only strain of Haemophilus influenzae that has a vaccine. Which is why we can see that the percentages of bacteriemia with pneumonia and bacteriemia without focus, meaning that they don't know where it originated from, are well above 20 to even 40%, even 59%. Now, I like to talk about this, and I will talk about this more in the next slide. But for now, I just want to highlight the effectiveness of the HIV vaccine and the fact that more people need to be more aware that we have this vaccine. And I'll get into that more in a second, but that's kind of the main thing I wanted to highlight and what I found interesting about this data. And so, so as we can see here for the serotypes, so serotypes are just a variation in a microbial species, and this is identified by the antigens on their surface. So these are all different strains, I suppose, of Haemophilus influenzae. As you can see, HIB is very controlled due to the vaccine. And then similar to this slide right here, we can see that there are two kind of outliers. We have non-B, so this is anything that is a non-B strain, so this could be HIA, anything from C through F, anything like that. And then we also have non-typable strains, so this is again, like, we're unaware of where this originated from. I like to highlight this just due to the fact that we need to be shifting more research into finding more vaccines or cures for those non-B and non-typable strains. I'm not completely sure why we haven't found any. Research just hasn't developed enough for vaccines to become, used for these strains. And then, of course, we can see a dip in 2020, consistent with the last data trends. A dip in 2020 and then a rebound. Once again, this is not due to the fact that it evolved or adapted in some sort of way. This is just due to behavioral changes. Something I also want to point out is the fact that in 2000, we can see it really starts to decline HIB. This is due to the fact that the vaccine for HIB started off in the 70s. So in around 2000 or 1997, we can see it still was a little bit up there in terms of cases. This was probably due to the fact that it was, 30 years is a long time, but in the sense of a vaccine, I feel like that's not actually that long. So we can see that it steadily starts to decline in the 2000s due to more people getting vaccinated. I also forgot to mention, I don't know if I did mention this, but around 80 to 92% of Americans before the age of 24 months have received either a full dosage or a routine dosage of the HIB vaccine. So that's something that I also forgot to point out. All right, and then something else that I want to talk about here are the age and serotypes. So, sorry, Haemophilus influenzae demonstrates this kind of U-shaped risk pattern. So we can see that there is vulnerability from your infancy, so your early stages of life, all the way to your late stages of life, so after 65 years old. We can again see that non-typable is, of course, a very dominant, strain or disease factor for Haemophilus influenzae. And then we could also see it at that around 5 to 17 years old, the cases have significantly dropped, opposed to years 1 through 4 or anything less than a year old. Again, this is due to the fact that, like I previously mentioned, before 24 months, everybody is getting vaccinated. All these children are getting vaccinated, which is good. And we can see that this is very effective because the cases have obviously dropped. Vaccines do offer long-term immunity, and we can obviously see it in this data. The other thing that I want to mention is the fact that HIA, so you can see HIA, and then is very prominent in the early years. especially in infancy. This isn't due to the fact that this is a super virulent or pathogenic strain. This is just due to the fact that there's no vaccine for it. And in your infancy, you are very vulnerable to these pathogens. Um, so yeah. All right, let's talk about some key takeaways. So some key takeaways about about Haemophilus influenzae that I would like everybody to know is that it's a bacterial pathogen. It's highly contagious, or not so much anymore, but it was. And it can cause serious infections such as pneumonia, meningitis, and sepsis. But due to the fact that we have an HIV vaccine, meningitis has significantly been suppressed and controlled, so that is not so much of a concern anymore. And then something that I've been emphasizing in previous slides is the fact that these non-typable strains have been the leader or the key have been the key strains for these invasive infections. It's something that we need to shift more of our focus on in terms of research. And then next up is that we do have antibiotics, and I'll go over some of the antibiotics that we have, but we do have antibiotics, but of course, bacteria over time will produce resistance to these antibiotics. And so I'll talk about this right here. So we can see some of the antibiotics here. And that's not why I put antibiotics necessarily on the screen, but I will talk about them. So I did list amoxicillin and ampicillin. Those are penicillin antibiotics. Haemophilus influenzae does produce beta-lactamase, or some strains do produce beta-lactamase. Beta-lactam is a ring found in, or a key structure found in penicillin antibiotics. This is essentially inhibits transpeptidase, which is a enzyme that cross-links the peptide bonds between NAG and NAM and acetylglucosamine and N-acetylmuronic acid. All of that together produces peptidoglycan. I know that's a lot. Essentially, beta-lactamase breaks down the beta-lactam ring, meaning the beta-lactam ring will not inhibit transpeptidase, meaning that peptidoglycan will remain intact, meaning that the cell wall of the bacteria will remain intact. Now, although this is a gram-negative bacteria, they still use penicillin antibiotics. I'm not exactly sure why. But anyways, that's not why I put antibiotics here for advice. I put antibiotics here for advice because I want everybody to be educated on how to take their antibiotics. And I want everybody to know how important it is to prioritize the correct instructions when taking antibiotics, so we can, reduce these antibiotic-resistant bacteria. Next piece of advice that I want to highlight is the fact that these vaccinations offer immunity, long-term immunity, and we have a vaccine for HIV. I don't want to talk about the politics of vaccines right now, but a lot of people are against vaccines for wrong reasons. But as we can see, and I put right here, who benefits from these vaccines would obviously be infants. So any children who are very vulnerable to pathogens as such will significantly benefit from these vaccines. Elderly will benefit from these vaccines. Immunocompromised will, of course, benefit from these vaccines. And then these are also the same people who are at the most are at risk, right? These are all vulnerable demographics for certain pathogens. And then another piece of advice that I want to kind of highlight on unlicensed advice is that if you are aware of a some sort of H. influenzae infection, remember that it is spread through respiratory contact, primarily spread through respiratory contact. So making sure that we're not coming face to face, making sure that you yourself, you're wearing a mask and you are being considerate of other people. So that is my slide for demographics advice. And then in terms of my reflection, so what did I find interesting about Haemophilus influenzae? I definitely say the biggest thing that I found interesting was the fact that this causes meningitis. I had no idea meningitis was even caused by bacteria. I thought it was some sort of viral infection. So I was extremely excited to learn more about meningitis. I know this is not a presentation on meningitis, but it is the most popular disease caused by Haemophilus influenzae. And then it is also responsible for a lot of other inflammatory diseases such as epiglottitis, and all those other ones that I mentioned. I personally found that pretty interesting. The other thing that I found interesting is the fact that we only have a vaccine for one strain of it, and the fact that that vaccine came out in the 70s and we have yet to come up with more vaccines for the other strains. So therefore, I wrote controlling one strain does not eliminate the disease entirely, because bacteria evolves, microbes evolve, they become more resistant to vaccines and antibiotics and stuff like that. And then it is not related to influenza in the slightest. Well, essentially what happened was that back in the day, in the 1890s, when the influenza pandemic was going on, um, they discovered Haemophilus influenzae, and they thought that this was causing the symptoms of the influenza virus. This was obviously wrong. Um, Influenza is a virus. Haemophilus influenzae is bacteria. So this is not related to influenza, which I had no idea because I thought the names, they were pretty similar. In terms of the data and how I interpreted the data, I thought the data was pretty easy to understand. I thought it was all pretty intuitive. Usually I struggle with reading graphs and timelines and stuff like that, but I think the CDC backfact really made that easy to understand. Something that I did need help on was a lot of the terminology. I did need to go back and do some research on that. Like I didn't really know what serotypes were necessarily, so that was something I had to touch up on. And then how did this improve my overall understanding? I think this overall improved my understanding just on how bacterial pathogens adapt, the certain diseases that they spread, such as meningitis, like I said previously, and the fact that a lot of these bacteria are even treatable through vaccines. Because I usually attribute vaccines with viruses and then antibiotics with bacteria. So it's nice to know that we can use vaccines for both. So that's all something that I found interesting and something that I think better improved my understanding, if I'm saying that right. And then these are my citations. So I use the CDC website, of course, and then I use backed facts as instructed. And then that is the entire presentation. Thank you, Dr. Morris, for such an amazing semester. And yeah.